Welcome. In this explainer, we're going to demystify one of the most misunderstood conditions out there, epilepsy. We're going to break down the science, bust some common myths, and really get to the heart of what's going on inside the electrical brain. So let's just dive right in. This quote, it really hits the nail on the head. Seizures can be incredibly scary to witness, but that fear often just comes from not knowing what's happening. Our goal today is to replace that fear with facts. Okay, so first things first, let's clear the air. On the left, you see all the stuff you might have heard, that it's rare, that you can catch it, that it's a mental illness. All of that is completely false. The reality over on the right is that it's actually a pretty common neurological disorder. It's a condition of the brain's wiring. Now, with those myths out of the way, let's get into what epilepsy really is. I want you to think of the brain as this incredibly complex electrical circuit. Well, epilepsy is what happens when that circuit sometimes gets hit with an electrical storm. Here's the official clinical definition for you. And honestly, the two most important words on this whole slide are recurrent and unprovoked. They are absolutely key to understanding what makes epilepsy a specific diagnosis. And this is exactly why those words matter so much. See, lots of things can provoke a one-time seizure. A really high fever, for example, but that doesn't mean a person has epilepsy. Epilepsy is all about an underlying tendency in the brain to have these seizures happen again and again without an obvious immediate trigger. Which of course brings us to the next big question. If epilepsy is the tendency to have seizures, what is a seizure itself? What is actually happening inside the brain when one occurs? So picture this, power surge. Normally, your brain cells, the neurons, are sending these nice, orderly signals. But during a seizure, a group of them suddenly starts firing way too much and way too fast. And, this is the crucial part, they all fire at the same time. It's this massive, synchronized, chaotic storm that just temporarily hijacks normal brain function. Now, here's where it gets interesting. Because that electrical storm can start in different parts of the brain, seizures don't all look the same. Not even close. So let's break down the main types. This chart breaks it down pretty nicely. You've basically got two main categories. Focal seizures kick off in one specific spot in the brain, and that can lead to some really subtle signs, like a blank stare. Then you have generalized seizures, which involve both sides of the brain right from the get-go. And those often cause more widespread effects, like convulsions. And this is so important to remember. We really need to toss out that one-size-fits-all image of a seizure that we get from movies. Those dramatic convulsions, that's just one type. A seizure can be as quiet as a moment of confusion or a little repetitive movement that you might not even notice. Okay, so we know what epilepsy is, and we know what seizures can look like. But what causes the brain's wiring to be prone to these storms in the first place? And how do doctors even figure it all out? Well, the causes can really be all over the map. It could be genetic, it could be from a brain injury years ago, or an infection. But look at that last point. For a huge number of people living with epilepsy, doctors actually never find a specific cause. And let's be absolutely crystal clear on this one. Epilepsy is a medical condition, full stop. It is not a character flaw. It has nothing to do with personal weakness, and while stress might sometimes be a trigger for a seizure, it is not the underlying cause of the disorder itself. What's pretty fascinating is how the likely causes can change as we get older. In kids, it's often linked to genetics or how the brain developed. But in older adults, something like a stroke becomes a major reason for epilepsy to start. It really can begin at any age. Diagnosing epilepsy is a lot like detective work. It's not just one single test. Doctors have to piece together all the clues, from the person's own description of what happened to what other people saw. And then they use tools like an EEG to look at brain waves or an MRI to see the brain's structure. Now for the most hopeful part of this whole discussion. Having epilepsy is not a sentence. It is a highly manageable condition. So let's look at how modern medicine can help restore the brain's normal, calm electrical circuit. The number one tool in the toolbox is anti-seizure medication. Now, these drugs don't cure epilepsy, but they work by essentially calming down that extra electrical excitability in the brain, making that chaotic power surge far, far less likely to happen. And how well do they work? Just look at this number. It's incredible. About 70% of people with epilepsy can get complete control of their seizures just with the right medication. That is a massive success story in medicine. But what about the other 30%? Well, the story doesn't end there. There are other really effective options on the table, like surgery, or special devices that can help regulate brain activity, or even specific diets that work for some people. And this really highlights something critical about modern epilepsy care. It's not just about stopping the seizures. It's about treating the whole person. Things like anxiety, depression, or sleep problems are more common, and dealing with them is just as important for a person's quality of life. Okay, this is it, our final section, and honestly, it might be the most important one. We've talked about the science, now let's talk about what you can actually do. This is practical, life-saving knowledge that can make a huge difference if you ever see someone have a seizure. There are just 4 simple things to remember. First, and this is the hardest part, try to stay calm. Your calm presence is a huge help. Second, do what you can to protect their head from hitting anything hard. Third, as soon as you can, gently roll them onto their side. This helps keep their airway clear. And last, check the time and see how long the seizure lasts. That information is vital. And what not to do is just as important. Never, ever put anything in a person's mouth. It's an old myth they can't swallow their tongue. And please don't try to hold them down or restrain them. You could actually injure them. And that 5-minute rule, that's your key. If a seizure goes on for more than 5 minutes, it's time to call for help. We're going to end with this thought, because it really captures the single most important takeaway from everything we've talked about. Epilepsy is a disorder of brain electricity, not identity. It's a manageable medical condition. It's something a person has. It is never who they are. And understanding that is how we replace fear with knowledge.